Hello, and welcome to Voices in African Health. This is the podcast where we explore the big questions shaping global health and connect them to realities across Africa's health systems, hearing directly from the people driving change. I'm your host, Sharon Quntai. Today, I'm joined by two guests who are deeply engaged in shaping how health stories are told and understood across the continent. Sheriff Bojang is the Deputy Political Editor at the Africa Report, and he recently moderated the launch of the Africa Health Media Trends Report here in Nairobi. We also have Ben Deighton, who is the President of the World Federation of Science Journalists, working with reporters and media organizations around the world. Together, we'll be talking about the future of health journalism in Africa and what comes next for the health media ecosystem. Hello, Sheriff and Ben. Welcome to Voices in African Health. It's great to have you both here.
Yeah.
Hi, Sharon. Happy to be here.
Amazing. So for a bit of context for our audience, this conversation builds on the Africa Health Media Trends Report, which looks at how health journalism is evolving across the continent, basically from the pressures that journalists are facing to the opportunities ahead. And just to point out for the audience as well, you can access the report on the Fin Partners website to be able to see the full report. So let's get into it. And I'll start with you, Sheriff. So on behalf of Fin Partners, you moderated a fascinating discussion during the launch of the report here in Nairobi. What was the moment or insight that really made you stop and think? Something specifically maybe that even captured where health journalism in Africa is heading now?
Again, thanks for having me, Sharon. I think we can agree that health journalism in Africa is entering a more contested, but I'll also say consequential phase. This reminds me of COVID-19, which was disruptive, not just in Africa, but across the world. That pandemic exposed both the power and the fragility of health reporting across the continent. And I remember, although it elevated public trust in science-based journalism, it also revealed deep vulnerabilities around issues like misinformation, donor dependence, and data gaps. So I think what's emerging now is a shift from reactive reporting to systems level scrutiny. Some journalists, of course, in some countries are doing better than others in other countries, but I think likely journalists in Africa are increasingly interrogating not just outbreaks, but the political economy of health. For example, who funds it, who controls the data, and whose expertise counts. This includes SAPA reporting on pharmaceutical supply chains, on vaccine sovereignty, climate health links, and growing role of private capital in shaping health outcomes. So to sum it up, at the same time, the information ecosystem is fragmenting. Social media and diaspora-driven narratives are competing with traditional outlets, often amplifying both critical voices and misinformation. So this puts pressure on journalists to move faster, verify harder, and engage in audiences more directly.
That's a really interesting reflection, Sheriff, and also pretty broad because the very first edition of the Africa Health Media Trends Report was done in 2021, I believe, post-COVID. So definitely, I agree, that is the first time that we were actually seeing a lot of shifts and in terms of headlines, a lot of shifts also coming into health. So that's a very interesting reflection. And the interesting thing also is that we are seeing that these challenges aren't also just unique to African media only, but also globally. So, Ben, you work with journalists globally. And when you listen to African reporters talk about the pressures that they're facing, for instance, the funding cuts and shifting health priorities due to the funding cuts, digital disruption, how similar is that to what journalists in other regions are experiencing, and how are they overcoming these challenges according to you?
Hi, Sharon. First of all, I would really support what Sheriff said. We're facing this fragmentation in the media landscape, and at the same time, we're looking at the rise of generative artificial intelligence. And that means that, journalists are faced with a tide of misinformation. You can't trust what you see online. If there's a video of a policymaker talking, you don't know if that's a deep fake or if that's actually them. And this is worse and more acute in Africa, I would say. And the reason for that is that the social media companies pay quite a lot of attention to monitoring and policing their output on platforms in the global north, but not so much attention to the global south. And that means that journalists in African countries who are often operating in low resource settings, who don't get paid enough, are also having this much more challenging battle against fake news. And it comes at a time when science is being undermined. I mean, we see what's happening in the United States. We see with the National Institutes of Health that the vaccines are being questioned, the science is being questioned. We need good journalists to put the record straight. And this all comes in a context where funding for journalism is falling off a cliff. Now, this is not so much a problem. It's a problem here in the global north, in richer countries, of course, but it's a much more severe problem in poorer countries where there isn't the self-sustaining media. So here in rich countries, most media can survive through advertising, and you have some very large, especially science news publications. But in many African countries, there's a market failure, and those publications survive on the grants given to them by philanthropic foundations and governments. And those grants are drying up just at the time when we need those journalists the most.
Absolutely. It's very true. Also, the fact that you brought up misinformation is this is something that we saw a lot coming in as results for the Africa Media Trends report. This is something that came up that media are now really keen on making sure that stories are data driven based on the issues such as misinformation, like you mentioned. And also, Sheriff, just looking at what else is being covered now, going back to Africa, journalists discuss the importance of covering issues such as non-communicable diseases, mental health, and again, health financing. So how do you see the focus of health reporting in Africa specifically evolving over the next few years? And I know you touched on it a little bit at first, but maybe just to broaden it up a little bit.
Yeah, and just quickly before that, in addition to Ben's the list that Ben made, for example, the issue of funding in particular, and then misinformation. In addition to that, I think is also the issue of priorities. Oftentimes, health issues, no matter how serious they are seen as secondary issues when compared with, let's say, political issue. For example, at the moment with the Iran war going on, the Middle East crisis, I know a lot of newsrooms where this is the priority now, covering this war, this conflict. Any health-related issue that comes to editorial desk are pushed to the back burner and stuff. So those issues are there. I thought I should add that there. But to answer your question, I think health reporting in Africa is shifting from, let's say, crisis coverage to long-term systematic issues. Again, some journalists are doing this better than others, but I think generally we've seen more and more journalists, African journalists, especially the younger generation, focusing more on issues like non-communicable diseases, mental health, and how health systems are funded and run. Now, the key challenge is a move towards accountability, looking at who pays for healthcare, who makes decisions, and how policies affect everyday lives, rather than just reporting on outbreaks and emergencies. So I believe the next phase of health journalism in Africa, or in a lot of places in Africa, will likely be defined by three tensions. First, I think is independence versus donor influence. Then you have the local expertise versus global narratives. I think we've discussed a lot these issues during the launch of the report. And then the third tier will be the speed versus credibility. The outlets and reporters that can navigate these tensions, I think, while grounding their work in local media realities and data, I think those will shape not just the story of health in Africa, but the policy decisions that follow.
Indeed, indeed. And that evolution also ties quite closely to how people understand the broader changes in health systems. So, maybe just to stay on very last question about the shifts, Ben, going back to the global side, what role do you see, or rather think journalists should play in helping the public understand the changes that are happening? And what do you think this could mean specifically for health systems in Africa and globally?
Yes. So what we're seeing as funding for journalism dries up, we're seeing more and more journalists going to work for institutions, media relations, and this is really a big problem because even though those organizations probably have the best will in the world, um, they're still not going to criticize, for example, their own institution. They're going to gloss over failings if an institution is reporting on its own research. It's going to gloss over if things aren't working exactly right. Maybe exaggerate the importance of it, and it means that critical role of holding power and funding agencies to account is being undermined. So we need people to wake up to this. We need the funding ecosystem to wake up to the fact that journalism is being seriously eroded. And the result of that is a weaker system because obviously journalism is the fourth estate. Its job is to be a check and balance against political power, against misuse of funds. And that role is disappearing. So it's really a very critical situation that we're in now. It's a kind of code red for our sector.
Absolutely. Yeah. And of course, how these stories are being told, matters now more than ever. And, we need to see that what is being covered really help people to understand the actual challenges that are happening. Just another question for both of you to move us away from the funding shifts. One of the other themes that emerged from the report was the need to combine strong data with human-centered storytelling. In practice, what does that really look like? What makes a health story both scientifically credible and emotionally compelling for audiences? Let me start with you, Sheriff, and then Ben, if you have other things to add on to this.
Yeah, this is actually a very interesting question. It's a very good question for a journalist who is passionate about storytelling. I've always seen myself more as a storyteller than a journalist. So that means human-centered storytelling, putting human face to every story matters a lot, especially in sometimes complex scientific or health stories. So to answer your question, I think in practice it means pairing evidence with lived experience. A strong health story starts with, I think, solid data. We can agree on that. Credible studies, local statistics, expert insight to establish what's happening and why that story matters. But it becomes compelling when that data is grounded in real life. For example, a patient navigating treatment costs, a nurse in Nairobi dealing with shortages, or a family coping with chronic disease or illness. I think the balance is key. Yes, the data gives the story authority, but what gives it meaning really is the human narrative. So when you are a human face to the numbers, to the data, you realize that your audiences don't just understand the issue, but they feel its impact, and then see why that particular story matters. So I think, um, you know, no matter how complex and complicated a health or scientific story is, putting human face to it and then matching that with the data gives it a lot of significance, and also strengthen its importance, but also enable people to understand without having to cut their head.
And Ben, just bringing in your scientific journalism background, what are your thoughts? Do you have anything else to add to this?
Yeah. So, well, I mean, Sheriff is completely, I mean, I completely agree with what Sheriff says. The human stories matter immensely, and that's what it's really all about. So without those, the data is just numbers. And I was very lucky to have been invited by Fin Partners yourselves um, to a workshop, a policy workshop. And in Rome. And one of the things, and this was a workshop about how medical practitioners can really best advise governments. And one of the messages that came out to me very strongly was the importance of personal stories and emotion. And I think if you're a policymaker, that's what resonates with you. So, if you, if to, it, for a story to really change policy, I think the personal anecdote, the tale of the individual is critical. And so, yeah, I think that those personal stories matter immensely.
Absolutely. Yeah, yeah. And what do you think still, Ben, what do you think will be the most important in strengthening health media systems now moving forward, looking at all these things that were coming up? Do you think what health journalists need now is more training? Do you think we need newsroom investment, or is it partnership, or is it something else?
Yes, so I think that it's really funding. I mean, the problem is that health journalism operates in a situation of market failure. And as Sherif said, editors and readers, they'll go for the political stories, and politics and sport. They're the things that will drive clicks. But actually, what really matters is health, because especially nowadays, with climate change and the increasing encroachment into the natural world, we're facing more and more health challenges. And so that health journalism is critical because it enables people to understand, why should I go and get vaccinated? Well, what's that all about? To realize that it's not a conspiracy. There's really sound, solid science behind it, and it works. It's proven to work. So health journalism is critical, and what's really needed for that is funding for journalism. So it can be newsroom support, and reporting grants are critical as well, because they allow journalists to really take a deep dive and to really get to the heart of issues. Training, I think there's too many organizations out there who consider that they should go and train journalists. I think that the training needs to be, the journalists themselves need to take ownership of their training. If they need training, they can ask for it. But all too often, you have international organizations going around training journalists left, right, and center. But really, what we need is money to do the reporting.
Absolutely, yeah. And just finally, also still on global coverage, some people are currently still saying that, they're arguing that global health coverage is still reflecting priorities that are set outside of Africa. So do you think, Ben, that African journalists are now reclaiming that narrative?
I think they need to reclaim that narrative. And I think there's so many really talented journalists and science journalists in Africa. And they need a platform. We need to give them a platform. And it's really critical because, back in the days of old when the news organizations in the global north would send their correspondent to Africa to report on something. Those days are behind us. We don't want to see any more parachute journalism. We want to hear the authentic voices of journalists on the ground who understand the issues. But again, it comes back to that problem of funding. We need to find ways to support those journalists to do that. We've got to hear their voices. It's absolutely critical. So we need people to support them.
Indeed. And looking at the people who are now coming into the journalism industry, new people in the industry, Sheriff, if a young journalist in Africa wants to specialize specifically in health reporting today, what skills do you believe should they focus on developing first, and what words of advice would you give?
I would say stay curious but skeptical. I think skepticism, especially in science reporting, is very important. Don't just report what's happening. Also ask who benefits, who is left out, and who is paying. I would also say ground your work in local realities and not just global narratives, as Ben said earlier, and always prioritize accuracy over speed. I think that's the advice I would give.
Oh, that's really great advice. And I totally agree with both of you. So just to get to the final question, and I'll ask this to both of you as well. As we look to the future, what gives you the most optimism, to go more on an optimistic side? What do you think gives you the most optimism about health journalism in Africa and probably also globally? And what do you think needs to happen next to ensure that journalists can keep telling the stories that really matter for public health? And I know, Ben, you've mentioned a few, but anything else that you can think of? Maybe let's start with you, Ben.
Yeah. There's a lot of reasons to be optimistic. There are some fantastic science journalists in Africa, and there's really the tools out there to support and help them. I mean, AI is a risk, but it's also an enabler for journalism, and I think that can give us a lot of optimism that there are some great stories being told. And in terms of what needs to happen next, again, I would just come back to that issue of funding, because the global health system spends so much money on advocacy and promotion, but all of that comes to nothing if there are no journalists to tell those stories. So, I would just reach out to the listeners of this podcast and say, please think of funding journalism, because journalists are a vital bridge between the work that many of these organizations do and society, and that bridge is crumbling.
Totally. And what about you, Sheriff? Anything else to add to that?
I totally agree with Ben. And for me, I think what's most encouraging is the growing depth and confidence of African health journalism. Um, of course, again, some journalists in some countries are doing better than others in other countries, but generally, I think more and more reporters are combining that local expertise and from storytelling to produce work that is both credible and impactful. So there's also a new generation of journalists, as we said before, willing to challenge the global narratives and center African voices and realities. So again, on the issue of funding, I think what needs to happen next is sustained investment in the craft, better access to data, more training in health and science reporting, and stronger editorial independence, which is very, very important. Stronger editorial independence from donors and political pressures. So newsrooms also, I think, need the time and resources to move beyond breaking news into deeper investigative work across the continent. I mean, all over the world, but particularly across the continent. So I believe ultimately the future depends on whether journalists are supported to do rigorous independent reporting that connects policy to people's everyday lives.
Totally. And that's such a powerful way to close. Thank you very much.
Just like to add that completely agree with Sheriff's point there. Absolutely.
Thank you. Thank you so much, Ben. Thank you, Sheriff. This has been such a thoughtful conversation, and I believe that you've left all of us, the listeners, myself, with a lot to reflect on when it comes to the future of health journalism in Africa and also globally. So to our listeners, thank you for tuning in. This has been Voices in African Health. Be sure to follow us on Podbean, Spotify, or Apple Podcasts so you don't miss future episodes. Until next time.